Hi, everybody. Thank you for joining us today for this Instagram Live session hosted by our dermatology practice, Westlake Dermatology. Our topic today is on vitamins and how they impact our skin. And I'll be joined by my friend and colleague, Dr. Lindsey Richards. And in the meantime, I'll tell you a little bit about myself and my background. My name's Elizabeth Geddes-Bruce. I'm a board-certified dermatologist, and I have been in practice with Westlake Dermatology for about 4 years now. Attending medical school, I actually got a Master's of Science in Human Nutrition from Columbia University. So that's why I'm really interested in this topic and super excited to talk about it today with you. And still just waiting for Dr. Richards. Hopefully she can join us. This is my first time doing this, so there might be a little bit of technical difficulties. Okay, well, she is trying to log on. Let's see, let me try this way. Adding you, Lindsey.
Hi.
Yay!
Can you see me?
I can see you. Welcome. Fantastic.
Thank you. I'm sorry.
That's okay. That's okay. I was feeling a little awkward by myself, looking at myself. I know there's other people out there watching, but it's so nice to see your face and have somebody to chat about this topic to, somebody who's also interested in it. So I already introduced
I know.
myself.
Thank you for hosting today. Sorry, I'm definitely the newer of us two on the Instagram live feed, so I was trying to sort it out.
That's okay. That's okay. Go ahead. Please tell us a little bit about yourself and why you're interested in this topic.
Sure. So a little bit about my background. I was actually in the corporate fashion industry for some time, and I finally decided I wanted a life full of learning and switched to medicine. Felt like I could make more of an impact, and I think just my visual aspect and being sort of a visual person and a design-oriented person, dermatology attracted me. And here I sit today. I went back to school at Texas A&M and then completed my residency at Columbia in Manhattan and started with Westlake last fall. So I'm super excited to be here. I love the idea of, vitamins and the health of your skin is based on sort of what you put in your mouth, and the old adage of you are what you eat, I do think is true. So I'm excited to talk to you more about it today.
Excellent. Okay, great. Just a reminder for all of the people who are watching us, please feel free to post any questions that you might have, and we're going to leave some time at the end to go over those questions and just answer what you're wanting to know about your skin. So I think, the connection between skin and diet, it really seems intuitive. And our patients, they're just craving to have more education about diet and nutrition and their different diseases. So let's just jump into it. Let's talk about it. We can start with diet and acne. That's probably one of the most common things that I hear when I have a patient comes in with acne. They want to know, is it something that they're eating that's causing the acne? Is there something that they can remove from their diet to make their acne get better? And I would say that there's a lot of studies that have been done on this, but nothing too terribly conclusive, but definitely a few associations that we can talk about. I think probably for me, probably the main thing that I talk to my patients about is the harms of a high glycemic diet.
True.
We definitely know that foods that are highly processed with a high glycemic index lead to a spike in insulin, leads to more oil production, can contribute to their acne. A lot of patients ask about dairy. What do you think about that, Dr. Richards?
Oh, I think there's probably a weak association. I mean, if you kind of go back to a high glycemic index and you think about that dairy, it actually is a form of sugar. It's lactose, and toast, it's a type of sugar. So there may be a weak association, but I don't think it's as strong as just the true high glycemic index diet. I often get asked about, protein shakes and whey that's out there. Whey is a byproduct of milk. It's actually what's formed when you kind of change milk into cheese. So if you're going to go ahead and say, okay, there's this weak association with dairy, then you could, speak to the fact that you should, not add whey protein. But in fact, I don't really see that causes a problem unless it's somebody that's drinking plenty of protein shakes a day, working out more than once a day. I do have those patients that are, really intense about their physical fitness and do a lot of protein shakes. And in that instance, I would just say, change to a plant-based protein, like a pea protein. But, I think the dairy and whey is sort of a weak association. And then I also get asked about chocolate. So I don't put a lot of emphasis on that. But, if I always say, and you kind of touched on this, education is power. And so you want to educate your patients the best that you can, but then you also have to tell your patient, you are your best advocate, right? So if you're being self-aware and you're noticing, trends in your body or associations that you think when you stop eating this, it gets better, then by all means pursue it and test it out. And if it works for you, do it,
Yeah, I completely agree. I think that if people want to do a trial of eliminating a certain type of food from their diet, then and they see an improvement in their skin, then all power to them. I think that, I agree with you on the whole dairy thing, that the data is not super strong. It seems like there is a little bit of research to suggest that skim milk, if you're drinking a lot of skim milk, then you might be
true. Yeah.
getting more of the androgens without the estrogens, and that might be contributing to your acne breakouts. But in general, dairy is not the devil. Yeah. What about sort of like different supplements or other things that people want to take for acne? Do you have any experience in that, or any recommendations?
No, I mean, I don't really recommend any supplements. It's just more, what are we going to do to treat the skin, starting with like a retin-A or a tretinoin. I don't know. Do you recommend a lot of supplements?
It depends on the patient. If they're really interested in it and they're very motivated, I mean, I think I agree with you completely. A retinoid is sort of the backbone of my therapy for my patients. But you do have those people who come in and they just really want to try some sort of dietary modification. And not so much about eliminating things, but sometimes if I see, an adult female patient with like a predominant hormonal component to their acne, where I'm already thinking that maybe they're having a little bit of excess androgens or more sensitivity to their androgens, I'll recommend food choices that have a little bit more of an estrogen component, like, well, see if you can increase your flaxseed oil consumption, beets, yams, soy products, things like that. There's a few supplements, even some of them that made it into prescriptive medications, looking at B vitamins for the treatment of acne. People sometimes recommend niacinamide or nicotinic acid, pantothenic acid, that's B5. But all those have a limited role. I think you're right. Like the medications that we prescribe have a lot more evidence to back them up and often get our patient with clearer skin quicker.
Yeah. No, the supplements is always good, like you said, in a very motivated individual. But, I think there has to be a lot of motivation to try an alternate route. And a lot of my acne patients want to come in and they want it to be gone. It's not something they want to look at for a long time. They want a solution.
That's totally right. Well, what about if we move on to something like rashes? A lot of patients come in, especially moms with their kiddos, and the kids got very bad eczema flaring, and they want to know, is there something in their diet? Is there something that they can change to make this kid's skin better? What do you tell those patients?
Well, it's interesting because I think a lot of people think that it's in the blood or there's a solution and, you just need to test my blood or there's something I can stop and this eczema will go away. And oftentimes it's in young children that it's the worst. And it's a large chore for the parents to really take care of it because it's a lot of application of different emollients and and different medications. And so what we kind of talk about is there's this thing called atopy, where it's eczema, seasonal allergies, and asthma. It tends to go together. You know, it's like a triad. And so there are kids who have allergies to food where the food does exacerbate the rash. But in actuality, when you speak with an allergist, that they will say there's a lot of false positives. If you just are going to do a blanket test for all food allergies, you'll find oftentimes that a lot of them will appear positive when the child doesn't actually get a rash or a reaction. And so you don't want to do that, because then you're limiting what the child can eat. So usually I just tell them, you know, listen, is there a correlation when they eat strawberries? Do they get hives around their mouth, or they get a rash when they eat peanuts, or, you know, are they getting short of breath, or their lips swelling? If there's a visual reaction, then I say, okay, let's figure it out. Let's get it tested. Oftentimes they already know that by the time they come to us. But I tend to steer towards, you know, is there an actual physical reaction you can see? And let's focus on that. I will say there is some data out there that talks about a gluten-free diet actually helping atopic dermatitis or eczema. But then there's studies that say, yes, do it, it's helpful. And then there's other studies that say, we didn't find much help. So it just, again, goes back to the power of you as your own advocate. You know, if you find that it's helping, then, you know, do a gluten-free diet. If you don't, then maybe that doesn't work for you. But it's just important, especially in kids, that you maintain a healthy diet that is diverse, because I feel like some parents get so worried and concerned about this rash that they start taking all of these things out of the diet. And then I've actually seen children that are nutritionally deficient because of that.
Yeah, definitely. Yeah, I completely agree. I try to focus more on not what you need to remove from your child's diet, but give them things that they can sort of add that will make the skin a little bit better. So, you know, it's really difficult to sort of like hydrate or moisturize your skin from the inside out, but there is a little bit of stuff out there that can be helpful. You know, contrary to what everyone thinks, you can't drink your skin into being moisturized. Patients are always like, oh,
Yes.
I'm so dry. I'm so dehydrated.
I totally
drink
agree.
more water. That's unfortunately not the way it works.
Right.
You can increase things like omega-3 fatty acids, vitamin E, some trace minerals, and get better hydration in your skin, or make the skin's barrier function better to prevent more water loss. There's some decent data for hemp seed oil. You know, patients love oils. If you take about 2 tablespoons of hemp seed oil a day, you can improve the moisturization in your skin. Topical vitamin B12 has been shown to be anti-inflammatory, so that's an option as well. What about like coconut oil? I'm sure you've heard things about coconut oil.
Coconut oil, same thing, anti-inflammatory, antibacterial. It's a great choice in terms of, it actually has been shown to help with wound healing too, because there's so many oils out there, right? There's avocado, there's olive oil, there's sunflower seed oil, hemp seed oil. So yeah, for me, I usually will say, you know, you can try coconut oil. Hemp seed oil is another good one. I do have people that'll say, well, I'm using olive oil, and it's not bad, but I would steer more towards coconut oil, especially in somebody that has eczema, right? Because they have that skin barrier that's compromised. And if you have an antibacterial or antimicrobial component to an oil and you want to continue sort of that naturalistic approach, coconut oil is going to be a better choice than, say, olive oil.
Yeah, I agree. Olive oil sometimes can be actually harmful to the skin. Yeah. And, you know, coconut oil, as long as you don't have an allergy to it, works fantastic. Sunflower or safflower oil, like you mentioned, is probably one of the best ones that we can put on our skin. They have done different studies looking at premature infants in the NICU and shown good improvement in their skin barrier. And those little babies are fighting off a ton of stuff. So I think if it's good for them, it can be good for us too. Let's see. So what about, is there anything when you're looking at your patients on exam, you know, say they come to you, that would make you worry about a vitamin deficiency?
Yeah, sure. It's like a classic board question, right? We all are trained to learn those. But in fact, in the developed world, we don't tend to see them extremely often. We see them more with, fad diets or people that are alcoholics. But just some, you know, factoids that are coming off my head. You can see something called corkscrew hairs that are actually the little hairs in the follicle are curls, or you can see hemorrhage or little areas of blood underneath the skin around the follicle. You can see enlarged gums. Those are all signs of vitamin C deficiency or scurvy. And I'm sorry, I love stories, so tell me, you can say stop. But, you know, scurvy, they used to, you know, I don't know if you've ever had somebody call a British person a limey, right? Well, limey comes from back in the 15th and 16th century when the sailors from Britain were going over to the New World colonizing, and they would all end up with these corkscrew hairs and this, you know, blood next to their hair follicle and these big gums. And it was because they were vitamin C deficient. So they started carrying limes on the ships, hence the limeys, British people. I just think that's a little fun tidbit. But sorry, to get back on course. Other signs, you know, a zinc deficiency, you think about sort of a rash around the mouth, around the bottom area. You can see it in children breastfeeding or who stop breastfeeding. And, you know, those are some of the main ones. If you have an alcoholic, they can actually have sort of like a dandruff-like rash, cuts around the angles of their mouth that look painful. That would be a vitamin B6 deficiency. But probably more current in our fad diet world now would be a keto rash, because lots of people are doing those keto diets. They want to stop eating carbs. And I've seen my fair share of that. They come in with this intensely itchy rash, and they can't quell the itch. And it's usually just on their trunk area. I see it more in women than men. And it's when they finally entered into ketosis, right? And they get this itchy rash. And oftentimes, you know, some can work through it, but in my personal experience, I've found that unless they reintroduce some carbs, they can't get rid of it. And some of them will come back and try it again, and they get it again. So it's almost like if they're apt to get it, they're going to get it.
Yeah, that rash is so cool because you can walk into a patient's room and be like, "Are you on a ketogenic diet?"
Yeah,
and they think you're just magic because you can tell. And
they're like, "What? How did you know?"
Yeah, it's really neat. But I completely agree. You know, everyone wants to know if they have a vitamin deficiency. I think it's really hard to develop a vitamin deficiency these days where we are, as long as you're getting adequate nutrition. You're right, like severe malnutrition, you can develop all sorts of different vitamin deficiencies, but the average person is getting what they need, at least the minimum amounts. And that a lot of that has to do because our food is fortified in the United States. You know, we've got iodine with our salt to prevent thyroid issues. We have vitamin D added to milk. That's how they eliminated rickets in the 30s. Our flour products have niacin and folic acid and iron and all sorts of vitamins in them, so that we're okay on that edge. So yeah, I think that's definitely the truth about deficiencies, that they're just kind of rare. I think it's a real interesting thing for us to think about. You know, we know that if you have a deficiency and you correct it, we can make the skin better. But if your tank is pretty full and you're taking different vitamins, can we improve the skin? And that's something that we need a little bit more data on.
Mm-hmm. Definitely. But it is definitely almost difficult to become deficient in our society with everything that's been fortified.
Right. What about one other thing? Hair loss.
Hair loss. Oh,
Any
hair loss is
that
tough,
you recommend
right?
to your
You know,
patients? Yeah.
say that again.
Any supplements or anything that you recommend to your patients?
I don't really recommend any supplements. You know, there's a lot of talk for biotin. You know, do I take biotin with hair loss? Do I take biotin for my brittle nails? The data really isn't there. So for me, you know, if somebody comes in with like an alopecia areata, you know, I'll do thyroid studies and lab work from that standpoint. If there's another, you know, is it like a chronic telogen effluvium? Maybe then I'll do an iron and vitamin D, which, you know, sometimes can provide answers and sometimes it can't. Hair loss as in general is sort of a tough egg to crack.
Yeah, I completely agree. And I think something that you touched upon, but I'd like to just make it explicit to the listeners is, you know, we're talking about hair loss because we know there's so many different forms of it, but for the average listener, if you're experiencing hair loss, this is a reason to go see a board certified dermatologist. So
Right.
that way we can sort of classify you into the different types of hair loss there are and try to give you different solutions to treat your problem.
Yeah, that's a good point, Elizabeth. There's a ton of different types, and that's,
Yeah.
you know, that's something to wade through in its own self with dermatologists, because sometimes you can have more than one type, you know, and it's important to figure out how to best treat it.
Great. So let's see. I was going to say, I agree with you. I check iron, vitamin D sometimes. Vitamin D is a hot topic. It is sort of everywhere in the media. It is something that, you know, is being studied constantly. And as dermatologists, people are always, you know, fighting back on, we tell them to protect themselves from the sun, and they say, well, we need vitamin D.
Right.
And I think that you and I talked about this, and we agree that it's all about striking a healthy balance.
Right.
You know, you can't get enough vitamin D just through your diet. You can't eat your way to enough vitamin D. You'd be eating like pounds and pounds of gross, oily fish. And I think it's also like a misconception from patients that they think that all dairy products contain vitamin D, which is not true. It's just milk, specifically cow's milk.
And
right?
I was reading the other day, you need 1 quart of milk to get the 400 international units. So, you know, the recommendation is actually increased to 800 international units daily, but you need 1 quart of milk. I mean, I definitely don't drink a quart of milk a day. I don't know.
And you're right. And those recommended units are just based on consensus, no actual scientific evidence. And the requirements are actually probably much higher. So if you're trying to like eat your way, drink your way to your adequate vitamin D stores, you're going to fail miserably. So what kind of things do you tell your patients, or do you practice with your own self and your family regarding getting enough vitamin D, but also protecting yourself from the sun, which we know is radiation and causes skin cancer?
Right. Yeah. So, I mean, I think it's important to kind of go back to the beginning so that, you know, the listener understands vitamin D is synthesized in the skin. And so us as dermatologists sort of have this love-hate, you know, because vitamin D is exquisitely important in controlling our bone mineral density. And then, like Elizabeth touched on, this is like the hottest new topic with the COVID pandemic, and, you know, how vital is it with our immune system and what role does it play? So, you know, we as dermatologists say, don't go out in the sun, don't go out in the sun, cover yourself up, don't go out from 11 to 2 or 10 to 3. But in reality, you know, we do need that vitamin D. And if you can't get it through your diet and you're not great about taking supplements, then I personally, and I tell my patients, you know, listen, go out in the middle of the day for 15 minutes and just get just a little bit red. And then I want you to go back in and put in sunscreen, you know, because the amount of vitamin D that they can synthesize and produce in that time is vital and important. I was reading somewhere the other day that actually it was, I think, the Harvard's Women's Health Watch, because I just get, you know, emails from them. It was saying that in the winter, if you live above 37 degrees latitude, which is, they use the example of Atlanta, it's almost impossible to get enough vitamin D if you're north of Atlanta, because UVB is what actually helps us synthesize vitamin D in our skin, and the sun never gets high enough in the atmosphere to get enough UVB. So in that regard, you know, supplements are important, especially in the winter. But us being down in Texas, we have a little bit of an advantage. So I do tell them 2 or 3 times a week, go out, you know, get 10, 15 minutes of sun, but the rest of the time I want you to have sunscreen on.
Yeah, I think that, you know, to some of our colleagues, they might go, oh my gosh, that's crazy, never. But I kind of like your approach. I would say with myself and my family, I kind of look at sunscreen kind of as the very last thing that I want to do. When we are at the swimming pool, we wear sun shirts. You know, we do avoid that kind of like high peak hours.
Right.
I am a person who puts sunscreen on my face and neck every day, but that's because I'm trying to prevent aging. I don't slather every bit of my forearms. I don't try to cover up every other bit of my skin, because I know that just a little bit of ambient exposure is helping me make enough vitamin D. I think that you're right. You know, we kind of need to sort of individualize our recommendations to the patient that we're looking at, right? Like a very fair person, we have to take into account how easy they burn and also how easy they do make their vitamin D with
Right.
just quick exposure. Whereas some of our more dark skinned patients, it's very difficult for them to get adequate vitamin D.
Yeah.
They absolutely need to be taking supplementation.
That's a really good point. Yeah.
Unless they're, you
The
know,
darker their
spending a lot
pigment.
of time.
Yeah. Yeah. It's actually harder for them to get that synthesis in vitamin D because they
Right.
just have more melanin. Um, that's a really good point. Yeah, I definitely do the sun shirts and the sunscreen too, but I sort of like think of it as a percentage. So if I'm in shorts and a t-shirt, I'm quote like 50% exposed, right? If I am in long pants and a t-shirt, then I'm 25% exposed. And then if I wouldn't be, but if a gentleman was just in his swim trunks, he'd be 75% exposed. And you can kind of, you know, gauge your time in the sun. Like if you have more skin exposed, you need less time. It just makes sense. But you're right. If you're darker skin type, other patients that have a harder time getting as much are the elderly, people that are obese. So those are things to consider.
Absolutely. That's right. Well, let's just jump into the whole COVID topic since we're already talking about vitamin D.
Sure,
What
sure.
have you been reading?
Oh my gosh, so much, right? I've never seen so much data on vitamin D, or I guess reporting on vitamin D. That's probably the more accurate. But you know, I mean, it's terrible what's going on right now. But it's one of the reasons I decided to jump back into school and be in medicine because there's so much new learning, right? You can just everything is new, and we're just learning at such a rapid pace. And, you know, I think a lot of the vitamin D reports in, you know, Wall Street Journal, the BBC, wherever you're reading it, is coming from this one study where they show that the countries with the worst mortality, like Italy, Spain, France, are the countries that have the lowest vitamin D. So there's not necessarily, you know, there's a lot of cofactors and variables that you have to account for because when you look and you read in between the lines and you actually look at the study, they didn't look at the medical history. And we know, you know, I think most of us do because we've all been reading that other comorbidities like cardiovascular disease, hypertension, you know, chronic pulmonary disease, diabetes, these are all factors for making COVID, you know, a poor prognosis. And they do point out that vitamin D, you know, supplementation isn't going to decrease your risk of actually catching the COVID, but it may have some potential for decreasing the you know, whether it's a poorer prognosis. So I do think that's really interesting. I was looking at a statement the other day that the British government is actually recommending that everybody take, they do it in micrograms. So I think it was like 25 micrograms a day of vitamin D during this pandemic while everybody's still inside. Not only from an immune standpoint and it's factoring into whether it's fighting COVID or not, but just because people are outside less. You know, they're all sheltering in place.
Right, right. Yeah, I've definitely been upping my vitamin D. Right, we know vitamin D isn't just important for bones; it's important for the immune system. And like you touched upon, people further away from the equator aren't doing as well, or aren't doing as well when they're fighting the COVID infections. Our darker skin patients, whether it's for socioeconomic status reasons or just inherent to their vitamin D status and potential deficiency, aren't doing as well with a COVID infection. So, while the data is not completely there yet to recommend it to everybody, I think the fact that we're all probably a little bit deficient is enough reason to, you know, increase your supplementation. I thought it was really interesting. I was reading that the idea behind this also is backed up by the fact that that bovine coronaviruses are actually like more harmful in calves that are vitamin D deficient.
Really?
And that was actually the research that first kind of got this going. And then everybody saw the different demographics seem to support that with the current infection.
That's so cool.
Yeah.
No, and I was reading, there's a 2000, it's an older study. I think it's like 2013 or 15, but it just talks about the vitamin D does so much in our immune system that we don't really even appreciate. And, you know, going back to the process of vitamin D, and I don't know if all of our watchers know this, but, you know, it's synthesized in the skin, but it's not its active form, right? Then it has to go through the liver, and then it has to ultimately go through the kidneys to become in its active form. But they're learning that a lot of immune cells have the vitamin D receptor on it and have the ability to actually translate the inactive form to the active form. And there's a lot of studies in the respiratory epithelium, the skin cells that line the trachea, have that vitamin D receptor too. And when they change vitamin D into the active form, it creates this microbial or increases the presence of this microbial peptide that is antibacterial, antiviral, and it helps fight the disease. So, you know, it has a lot of effects on our immune system that I think we're really still learning. Because if all of those immune cells and, you know, our respiratory tract have these vitamin D receptors that are making it into an active form and helping us fight, you know, pathogens, it could be, like you said, we probably need a lot more than 800 international units a day.
Yeah,
Right.
yeah. No, I agree. That's so fascinating. The vitamin D might help us actually fight off these viral infections.
Mm-hmm.
In addition to, it's also anti-inflammatory, and they think that it calms down that cytokine storm. So these
Right.
patients are often, they're not succumbing to necessarily like, oh, the virus, but rather the body's reaction causing lung damage. And so if you can calm that cytokine storm by making sure that you have enough vitamin D supplementation, I mean, that's really exciting.
Yeah, no, it is. So, and you know, I think for me, I'm not great at taking supplements, but the vitamin D supplement specifically, it's very small gel pill that's easy to swallow, and it comes in 1,000 international units. So I usually just tell my patients, you know, do 1 to 2,000 a day. You know, it's going to be, it'll be more than fine. And you know, you can go on the higher end if you're not getting outside.
Yeah, I take like around 5,000
Oh, you take a
international
lot.
units a day. Yes. But you know, for our patients, this is the kind of thing you can discuss with your doctor,
Right.
right? This is where we can be kind of an expert for them. We can say, you know, based on your skin type and your level of activity, your job, if you're always, you know, shift work, working at night, or if
Mm-hmm.
you're always inside behind a desk, and check patients' levels and see where their baseline is, where they start, and how much
Right.
supplementation they need just to get their stores replenished.
Totally.
Yeah.
Totally.
I think the last topic that we should probably touch upon before we sort of start answering some questions would be a little bit of this kind of like nutracosmeceuticals
Mm-hmm.
sort of spectrum of questions. It seems like
Yeah.
I got a few of those earlier. But like skincare, anti-aging, vitamins, things like
Right.
that.
Right.
What do you think about diet and your skin, like with regards to anti-aging?
Well, you know, it's like I said, I do think you are what you eat, and with our, you know, fortified um, diet in this country, it's hard to be deficient. But you know, making sure you get your decent amount of your leafy greens and your vegetables, and not going too high on the glycemic index, and filling your diet with processed carbs. All of those things I think are really important. And then whether you choose to be lactose free or gluten free, you know, that's back to the individual and their physician. I've gotten a lot of questions lately on collagen supplements, you know, taking collagen by mouth. And it's something that originally I had to be like, oh, you know, I don't actually know, like, how much of that is getting to the skin, because, you know, we think about collagen's really the building block of so many things in our body, not only the skin, but our ligaments and our bones. And you know, is it going to help with the aging process, you know, or is it going to help with the healthy appearance of our skin? And when you take it by mouth, it actually appears that probably 50 to 60% gets absorbed into the intestines. So it is being absorbed. The question is where is it going? Or is the skin going to reap the benefits? Is it going to be our bones? But there was a nice study done last year in the JDD that actually looked at all of the current studies out there with PO collagen or collagen by mouth. There's probably about 800 patients that they looked at in total. And at the end of the day, you know, all studies did show an increase in skin elasticity, an increase in collagen density. There's 2 studies that showed an increase in wound healing. So, you know, there's not really any negative or adverse effects. So I am recommending it to my patients now. You know, take the PO collagen. You know, I read one article that said, you know, we're not in the medieval times. We're not drinking bone broth and sucking on bone marrow or eating a lot of gristly steaks, which is really where the source of a lot of collagen came from. So it's not a bad idea to just take it.
Yeah, I'll tell you that as someone with a background in nutrition,
Mm-hmm.
when I first heard about the whole like collagen powder thing, I like instantly thought, well, that's just ridiculous because
Same.
when
Me
you
too.
eat when you eat any form of meat, it's broken down into amino acids and then that is taken and used where it's needed. But I gotta be honest, like all the data that's coming out has made me feel a little bit like, well, maybe we don't understand things as well as we thought we
Right.
did.
Right.
Because you're right, there are like good quality, double blind, placebo controlled trials where the patients who are on the active supplements of like collagen peptides actually do have increased hydration of their skin, which makes the
Mm-hmm.
wrinkles look better. They have
Yeah.
increased the thickness of their dermal collagen, decreased appearance of their cellulite. What? Like
I know.
that made me go out and buy collagen powder. So
Right.
I've got some like bovine stuff that I try to like scoop in every once in a while when I make a smoothie. It honestly tastes terrible, so I need to
Yes.
probably try the marine form. But
Yes.
it was enough that made me think, okay, I got to see what's out there. Um, there's a few other supplements, not just collagen, right? Like people wanted to talk about other skin supplements, like taking antioxidants and things like that. There was one study that I just recently came across when I was looking up this topic to prepare for this talk, which I thought was so interesting. It looked at patients who consumed a fair amount of almonds. It was like a randomized controlled
Okay.
trial. It was postmenopausal women. They had them take, I think, like 2 handfuls of almonds a day for like about 6 weeks. And they absolutely had like a blinded evaluator. The treatment group had improvement in their wrinkles, which I thought that
Oh,
was
wow.
fantastic and an easy way to just kind of like incorporate into your diet.
Yeah.
If you're going to be snacking on something and you're a little bit conscientious about your skin, its appearance, and your overall aging process, like grab some almonds. It's a healthy snack. It will keep you full and it might make you look better.
Yeah, that's a win-win-win. Like
Yeah.
you get full and you get younger looking.
Okay. What about I don't know. Let's see. Any topical products, topical antioxidants, right? There's a lot.
Topical.
Vitamin C, vitamin E. What do you think?
There's a ton. I mean, honestly, I think everybody should have a topical antioxidant. I think it should be on your face twice a day, incorporated into your skin regimen. For me, I recommend the SkinCeuticals, the CE ferulic acid. It just has it's the most evidence-based medicine. It has biopsy-proven results. They were the first one with the technology. And there's a lot else out there. And, I think that they're all great, but I just don't know in regards to them being the first out on the market and with all those biopsy proven studies, I just kind of stick with them. I know it works, it's
Yes.
effective, it's going to protect me from those reactive oxygen species, and I just would rather just stick with that. Vitamin E, I think, there probably still needs to be some studies on that, but I don't have a strong feeling one way or the other. If there's patients that are, opening up those capsules, you can put that on your skin. But I think you and I were talking about the other day how, it doesn't actually get down through the stratum corneum, which in all intents and purposes, that's a top layer of skin. That's sort of like the castle wall. So, if it's moisturizing, great, but how much is it doing? We don't know.
Exactly. No, completely agree. So vitamin wise, topical vitamins on the skin, they have to be formulated so that they actually penetrate that top layer like you're talking about. So um, I agree. I love the SkinCeuticals line. I like the vitamin C from Revision. These more sort of pricey vitamin C products, patients are often hesitant to buy them because they're not sure it's worth their money. But if you're using a vitamin C that's inactive, you're just wasting your money.
Right.
And I try to tell patients that it's kind of like, when you cut an apple and the apple turns brown when it's exposed to air, vitamin C just oxidizes so quickly and it becomes ineffective. So the one you're getting at the drugstore might not work well, or it might. I just don't have the data to tell you which way. And I do when it comes to the SkinCeuticals product. So I love to recommend that one.
Totally.
And again, that vitamin E capsule, right? That's the kind of thing that I kind of laugh to myself all the time. Patients, they want the purest form of vitamin E, so they get that dietary supplement and they rub it all over their skin. And I let them gently know that that's not vitamin E acting like an antioxidant. That's vitamin E acting as a humectant, which is still fantastic. It still helps to hold water into your
Right.
skin, but it's not doing any kind of like antioxidant, scavenging free radicals, that kind of stuff going on.
Right. Right. Totally. Well, should we see if we have any questions? I'm trying to figure out how to get the questions.
Yeah, so I have a few questions from yesterday, a few of them that we kind of already touched upon. I mean, two people wanted sort of specifics, like, is there a best skincare supplement that you would recommend? Is there any brand that you recommend?
Like, are you talking about like a Helioplex?
Like an oral one.
Uh,
Yeah.
yeah, I mean, Helioplex is really what I recommend more orally than anything else. Other than that, not really. I just think that being religious about your skincare regimen and putting on the antioxidants and the serums plus the sunscreen is probably the most important.
Yeah. I don't routinely recommend any specific supplement for my patients, but I know that there's one, and I'm not paid by this company, and I've never gotten it, although I'll take free samples if anybody's watching. It's called Lumity, and they have like Lumity. They have a beautiful published study done by Zoe Dralos, and it was enough that made me think, oh, I should try taking this. But it's nothing special, like nothing too terribly proprietary. It's just got, like a lot of antioxidants, omega-3s, trace minerals, things like that, that maybe if you're not having a nice varied diet on a regular basis, you might not be getting. So that's something to try.
I'm gonna have to try that.
Yeah, and then someone asked about an oral collagen supplement. I have no idea on a specific brand for that.
Yeah, I don't. It's probably something I need to dive in a little bit further in. And like you said, the bovine thing always it doesn't sit well with me. So,
and it tastes terrible.
I know.
Okay, and then one other question was, what ingredients should we look for to fight wrinkles or fine lines if we're trying to get pregnant? What would you tell one of your patients?
Wrinkles or fine lines. I mean, in food or in a supplement, I don't know. What would be your thoughts on
she didn't
that?
answer. I guess I would go more towards topical things if they're seeing us. And I would probably stick with things like azelaic acid, which we know is safe in pregnancy. It can work on pigmentation. Often pregnant women get melasma and things like that. Maybe glycolic acid, which is derived from fruit peels, and you could get some nice skin turnover and exfoliation. Or maybe just kind of like, don't worry about it.
Yeah.
Once the baby's out, then you can refocus on something like that.
Yeah, that's hard to tell. Your body changes so much when you're pregnant. Sometimes you're like, but what can I fix? I can't take any medications. I can't do anything that I really want to do normally. So yeah, the azelaic acid is a good recommendation. But I think sometimes just really taking in the 9 months and remembering that this is a special time to it will get back to normal and go back to where you used to be. Just takes time.
That's right. Okay, let me scroll through and see any other questions. And you guys, if you've got questions, go ahead and send them over. Let's see.
I'm looking too. I think I figured out.
Yeah, you just scroll. Yeah, there's another one about collagen drinks like Vital Proteins. I think we've talked enough about collagen, but generally the consensus is try it. Although they can be a little bit expensive. So, Okay, someone asked, what's the best form of vitamin D, sun or say like mushrooms?
I would go with sun.
Yeah,
as a dermatologist, it's like, that tug of war, but sun is your skin synthesizes it. And that's how the first step in the process. So I would definitely stick with sun.
Yeah. I mean, I think that also we have to remember that you get other benefits from being out in the sun besides just vitamin D. So it's kind of like, it's a whole lifestyle change, right? If you're out and active and you're breathing in the fresh air, you're making vitamin D, you're getting exposure to the sun, which probably helps your circadian rhythm, makes you sleep better at night. things like that. And I don't think that you can get enough vitamin D from mushrooms. In fact,
Yeah,
I don't
yeah,
know if mushrooms contain any vitamin D.
I would agree.
Oh, someone asked if we could please repeat the specific SkinCeuticals product.
Oh, sure. That was the CE ferulic. So Feurlic, I think, ferulic. Am I missing a letter? CE ferulic. It comes in a little dropper. And like Elizabeth said, I would agree definitely that it's worth, the money. The data is there, the evidence is there. If you're really looking at anti-aging, it's worth spending the money on.
Okay, good. And someone asked, what are some skin manifestations of COVID-19?
That's so interesting. My husband sent me the article. I think it was in the New York Times the other day, and I was like, "Thank you. I've been looking at this for quite some time." But it's really fascinating because what we're seeing as dermatologists are sort of a vascular occlusion process happening. We know it as something called pernio or chilblains, and you see it in cold weather climates or damp climates when usually in the extremities and like more of the toes, sometimes the hands. And we're seeing it as a COVID symptom, and it leads us sort of down a path, which I've discussed with other physicians, that, there's more to this virus. It may not all just be a respiratory virus. It could actually be affecting the coagulation cascade, like our clotting and how our blood flows and clots. And that's probably the main skin manifestation that I've seen of COVID. And interestingly, a while back before any of this happened, I saw a few examples and it didn't sit right with me. I was like, I'm missing something. And, a month later, we have all of this data that's showing us that lots of people with COVID are getting it.
Yeah, and we see a lot of the normal reactions to viral things, right? Hives.
Right.
And I think I've read that there's a lot more cases of zoster coming out. So people getting shingles who've had COVID, it makes them, a few weeks later, someone pops up with shingles, they might have had asymptomatic COVID, that kind of thing.
Right.
So another question, if supplementing with vitamin D, is there concern for toxicity? Should we check labs occasionally?
Well, to sort of give you a benchmark, somebody that's actually considered vitamin D deficient with laboratory values drawn, the recommendation is to do 50,000 units a week for 6 to 8 weeks. So the short answer is it's quite, I think, unless you have a difference of opinion, it's quite hard to actually get toxicity from vitamin D. Yes, it's possible. It's a fat soluble vitamin, but the likelihood is low.
I agree.
Yeah.
I think you're right. I think that the supplementation recommendations are really kind of all over there, all over the place, and we're trying to figure it out. Right. I think that if you are a provider, you could check baseline labs, pick the form of supplement you want to start. Like some people do the 50,000 international units twice, depending on where the level is, and then 2,000 daily. Some people do the 50,000 units, like you're saying, once a week, up to 12 weeks. I think maybe a 3-month mark is a safe time to recheck. And I think as a provider, you will be a little bit surprised at how inefficient you were at raising that level up.
Yeah, that is true. That is very true. I've gotten those repeat labs 3 months later, and I'm like, oh, really? And it's a compliant patient who's really following directions, and it didn't move the needle much.
Yeah. And a little bit of that, which we don't talk about that often, is that across the nation, the laboratory, the minimum level of what's normal, the bar has been raised. So we are seeing a lot of more people classified as deficient who, 8 years ago would have been considered normal. But with our whole lifestyle of being just a community that works indoors, we are going to be vitamin D deficient because that's the way we've evolved. We've evolved. We've got light skin. We've evolved to not be wearing clothes and to get our vitamin D from the sun. And now that we've changed our lifestyle, we're at risk to get that deficiency.
Yeah, totally.
Let's see. I've got a brand suggestions for facial sunscreen. Everything makes my face break out.
Mm. Well, okay. So I was going to give some that, but if it's a breakout question, I usually stick with Elta MD UV Clear. That's my go-to. And there's tinted and non-tinted. I'm a big fan of the tinted because I just think it sort of gives you like a glowing complexion. It's nice to just put on every single morning. And it's a moisturizer too. So it's a moisturizer plus a sunscreen. Other sunscreens that I love, Alastin, Alastin, tends to give you a little bit more like makeup-y
Oh,
coverage.
it's beautiful.
Yeah, but I don't know that I'd recommend it for acne prone skin. And then Revision has a great one, whether you do the matte or the classic.
The
Um,
IntelliShade.
the
Yeah.
IntelliShade.
When my patients tell me, oh, every single sunscreen breaks me out, I push them a little bit because I think that most sunscreens are non-comedogenic.
Mm-hmm.
But what I think people are seeing, especially if they're wearing the sunscreen and they're going outdoors in the sun, is a little bit of heat from the reaction. You know, if it's a chemical sunscreen doing that conversion, a little bit of heat causes a little bit more like a miliaria. And patients are confusing that kind of like almost like a heat
That's a good point.
with like an acne breakout. And it's not a true acne breakout. They're not making true comedones. It's just a little bit of a reaction that just has to do with more being
True.
out in the sun.
That's a really good point. Yeah.
But I love all those things that you recommended. I love all those sunscreens.
Are there any other ones that you love that I didn't say?
And I'm pretty acne prone. My favorite is Elta Elements. I think that the price point is awesome. I think that the tint is nice and almost like universal on everybody. And it's got hyaluronic acid in it. And I just love hyaluronic acid as a cosmeceutical. It just, at least while you're using it, temporarily plumpens the skin, gives you that nice dewy glow. I don't buy into that it's causing any increased hyaluronic acid production deep into the skin. It's not. But it's just making a nice temporary increased hydration on the skin. So that's the one that I wear.
Okay. I'm going to add that to my rec list.
Yeah. What about, okay, you mentioned HelioCare, and this is a thought on HelioCare, niacinamide, and skin cancer UV radiation.
There's definitely data out there that tells us that niacinamide is helpful for preventing skin cancer. And I think that's, the inception of Helioplex. And so patients that are have a history of skin cancer, or even younger patients in very sun intense places like we're in Texas, I will recommend it. It's just, to me, it's a matter of somebody want to take that oral step. Some people that have had long histories of skin cancer and are tired of going to the Mohs surgeon or getting excisions, they're like, yes, please give me something. Whereas younger people that may just have a family history aren't as apt to want to take it. But then, like you said, there's a lot of motivated people that just want to do everything in their power to be as healthy as they can. So I think it's a great source to take if you're willing to take a medicine by mouth.
Yeah, I gotta be honest. As much as I love nutrition and I talk about it all the time in my daily practice, I don't think about niacinamide for skin cancer until it's like a last ditch effort. Those patients that come in and every time you see them, you're biopsying off 5 to 10 different things.
Yeah.
And I'm like, how do we slow this down on you? Oh, let's try some B3. And maybe we should be a little bit more proactive and recommending it to patients, early, especially with a family history.
Yeah. I think it's worthwhile, especially in Texas too,
Yeah. And HelioCare, I use that more for pigmentary conditions. So a patient with melasma, they promise they're putting on their sunscreen and wearing a hat and avoiding heat, and they walk out and check their mailbox once and their melasma flares. Like that, to me, is the kind of patient that HelioCare can really provide just that little extra SPF. We should have explained this to anybody who's listening, but HelioCare it's an herb. It's from a fern, and the supplement basically gives you a little bit of natural SPF. It's got some anti-inflammatory properties, so it gives you some protection that you can take orally. You can take it just when you go on a beach vacation. You can take it every single day. Yeah. Anything else on HelioCare?
No, I think you covered it. That makes sense.
What else?
think somebody was asking about any other anti-aging serums. I'm a big fan of Neocutis. I think, again, it's a pricey serum, but it's worth the money. You know, there's proof in the pudding in terms of it restoring collagen and elastin. Elastin is something we stopped producing in probably our 30s. Maybe some people are lucky enough into their 40s, but that's really, you know, think about the rubber band effect. At some point you stretch a rubber band enough, it stops going back. Well, that's why gravity gets the best of us and our face starts to go down with age. So Neocutis, the serum, is something that I really believe in, and I do think is worth the cost. But again, it is expensive. Elastin has one. I'm blanking on the name of it right now, but I also think that's a good alternative. Are you there?
Oh no, I am. Oh, I was like, did they
Okay.
cut us off? You were talking about elastin. I love elastin. They have
No, you know, because my phone's low on batteries.
Oh no.
So hopefully it lasts.
I think we just have a few minutes left. Anyways, yeah. I was gonna say I love the elastin products as well. I think what's important is that you need to take time, make an appointment, go see your board certified dermatologist. We are the skin experts. We can look at you and make up something that's personalized to what you are dealing with, whether it's pigmentation, whether you're acne prone, whether you just have very poor skin quality because of genetics and you need this and that and the other, and come up with a regimen that's best for you. I agree that, like, you know, some of these products are expensive, but they are worth it rather than you going to like Sephora or CVS and buying tons and tons of things that are ineffective. I often tell my patients, you know, you don't have to splurge on your moisturizer. Moisturizers have like a few of the same ingredients. They've got dimethicone, they've got glycerin, they're petrolatum based, and you can find them at the drugstore or you can buy some nicer quality ones.
Right.
I mean, I personally do like sort of the nicer smelling ones. Like one of my favorite is Triple Lipid Restore by SkinCeuticals.
Love that.
It's kind of like a treatment with a moisturizer, but there's different things you can splurge on, and it's worth splurging on and incorporating into your routine, and other things that you can kind of relax on.
Yeah, no, with all my patients, I kind of go through, okay, like, we'll either talk about what's your budget for your skincare regimen, or I'll say, if I could do anything, these are the 5 things that I would do. But let's talk about in order of priority, what I would do first, second, third, because then that can kind of, you know, sometimes, you know, a lot of people are naive to skincare, right? They don't know all the steps. They don't know all of the ingredients and all of the things that you can use really for the anti-aging process. So if they just get into one and they're like, wow, this is really great, I can tell a difference, then they're ready to go for a second product. And they do that second product and they say, well, I see the difference again, you know, and before you know it, you have somebody that's very, you know, dedicated to their skincare regimen, which is great because it's not only for anti-aging, it's for skin cancer.
Well, I think we just have a few more minutes. Is there any kind of like few recommendations, just quick little things that you would tell people from this talk that you find most important that you'd recommend?
What would I tell you? Yeah, just take home points. I guess I would say sunscreen, sunscreen, sunscreen. It sounds so, you know, blasé coming from a dermatologist, but I can tell you, I've been wearing sunscreen since I was 18, and my sister would hate that I said this, but she's younger, and now she gets called the older sister, and it's because she didn't start wearing sunscreen until much later. So sunscreen is important, not only for skin cancer, but also for anti-aging. Antioxidant is really important, and while I sound like I'm talking out of both sides of my mouth, I would still say go out and get that sun, you know, 2 to 3 times a week for 10 to 15 minutes to get that vitamin D, because I think vitamin D does so much more than we can even really put our finger on.
Yeah, those are great. I would say if I wanted to do take home points for people, I would say snack on almonds.
Yeah, true.
to help your wrinkles and help your skin hydration. Right. And actually, there's evidence behind that. I would say take a vitamin D supplement and do live a healthy lifestyle where you are getting outdoor exposure, but always keep sunscreen on your face and neck. Okay. Right. What else? I would try a collagen powder if it's affordable.
Oh, you're right. I would add that too.
Especially if you are someone who limits your meat consumption. You know, I've been vegetarian, or I had been vegetarian for almost a decade of my life. I got pregnant, that changed. But if you do have kind of like a restricted diet in that way, I would consider that.
Yeah, that's a really good point. Well, thank you so much. This was awesome.
Thank you for joining me.
No problem. We got to
Okay,
shelter in place, but still talk. It was great.
that's right. I hope everybody learned something on vitamins, nutrition, diet, and their skin. And take care. We hope to see you soon.
Yeah. Bye bye.